Hey, this is Dr. Yates in Chicago, and this is a patient and a friend, Jonathan. And as we focus on him over here, we can see exactly how handsome he is, and you can see his hairline and how chiseled his features are. And it wasn't always that case, was it, Jonathan?
No, we've come a long way.
Come a long way. Of course, he was born like that. See, that's what happens with hair loss. You know, you're born a certain way, and then it goes away, and you move backwards, and then you say, oh my God, you look at yourself, I used to look better than that. I would say that to myself all the time. I would be more upset than probably anybody. So, Jonathan came to us and said, listen, you know, is there anything we can do? So, what we suggested, if we come in on this picture, and you can see how he didn't have much of a hairline. He was wearing his hair appropriately, which is short, but he just didn't have any structure to frame his face. So what we did, about a year ago, we did a transplant of 1,000 grafts to frame his face, and he got that frame. And this time we just added a little more, another 1,000 or so in there to create more density. And he's also had micropigmentation done, or SMP, and we've also done PRP. So the reason that I think that his results are so phenomenal because he followed it by the book. And I recommend to all patients, especially Afrocentric patients, that doing micropigmentation with a hair transplant is your best deal. And some people always say, why is that? I just come to you to get hair. Why I gotta do this? Why I have to do that? And the answer is because no matter how good a hair transplant surgeon is, nobody can get the density that you had when you were young. It's just mathematically impossible. Now, to make it better, to appear like you have that density, you just add some background micropigmentation. So I guess I've talked enough. What do you think about the hair transplant thing? I mean, you're young. I mean, what's your deal?
I mean, honestly, I came into this not knowing what to expect. You know, you see celebrities like LeBron James having difficulty, you know, getting their hairlines back, and
because he didn't come here.
Honestly,
Cameo didn't come here.
But honestly, I couldn't be more happy with my results. My confidence is back, and I'm excited.
Right. And I mean, what would you tell? I mean, I'm sure you got friends. I mean, I know you work out. You go to the gym and you see these guys. They got biceps and quadriceps and all kind of ceps across the room, but then they got one little hair sticking up. What would you say? Why are you going to work so hard? And I'll tell you the answer. The reason is all these other things they can control. So they're doing all these things, but you can't control this. And the other thing is, it's not like people don't notice. You know what I mean?
Right.
So they're all buffed out and got one little curlicue here, and people notice, you know? Hey, Ashley, come here a second. Ashley is my nurse practitioner, and she also does all the procedures with me. I'm just going to ask her a woman question. So, from a woman perspective, say you're out at a club. Ashley's married, so I mean, right, but I'm just saying from a woman perspective. If you're out at a club and you see this guy walk by, now you don't know nothing. You don't know anything about how smart he is. Okay, this guy walks by, or this guy walks by. Where's your eye gonna go?
It's gonna be this guy, just because he looks more youthful, vibrant, and I don't know, like he'd be interesting to talk to. He takes care of himself.
Thank you.
You heard it. Drop the mic. We don't say anymore. Come see us in Chicago. It's Dr. Yates. You can have really good results with Afrocentric hair. Yes, it is harder to do than Caucasian hair. Yes, we have done thousands of cases, so we're very good at it. We're not being arrogant or boastful. We're just telling the truth. So come see us in Chicago. We'd like to help you. Thank you.